Hello, hello. Let's look at the pancreas. Let's look at the gallbladder. This is just an overview, but the emphasis is physiology because I'm a physiologist, DRC wale, physiologist. Okay, and then I'll talk about a bit of obstructive jaundice. So what are we going to discuss today? We'll discuss. I'll just give an introduction, anatomy of the gallbladder, physiology of the gallbladder, anatomy of pancreas, and then physiology of pancreas, the biliary tree, and jaundice. Okay, anatomy structures, just to appreciate the structure of this same gallbladder. So let's get started. Introduction. How do I start? I can only say that the gallbladder and the pancreas are usually discussed together. One, what's the reason? Because one, they are part of the biliary tree. Two, usually disorders that affect the gallbladder will eventually affect the pancreas. Like, for example, if a person has gallstones, eventually it may also cause pancreatitis, which is the inflammation of the pancreas. There's also this condition, obstructive jaundice, where some ducts in the biliary tree are obstructed. Okay? And usually it's associated with the gallbladder and the pancreas. And when you remember your embryology, these structures, the pancreas, the gallbladder, the liver, they originate from the same cell line. So if you've forgotten your embryology, try to revise. It's a topic on its own, the embryological development of the GIT. Number two, let's look at the anatomy of the gallbladder. Before we look at the anatomy, look at the location. When you look at the abdomen, it has nine quadrants. Okay, these are very important. So, for example, when you're doing your abdominal examinations, a patient comes and you have to palpate to check for splenomegaly, to check for hepatomegaly, and all sorts of masses in the abdomen. You have to be considerate with these quadrants. There's a right hypochondriac region, then there should also be a left hypochondriac region. There's a right lumbar region, there should also be a left lumbar region. There's a right inguinal region, there should also be a left inguinal region. And then there's a pubic region, umbilical region, and the epigastric. So it's easy to remember these quadrants. Epigastrics above the stomach, umbilical region around the umbilicus, pubic, like the pubic hair, now the pubic region. Okay, so these are the nine quadrants. So where is our gallbladder located? It's somewhere at the junction of the epigastric and the right hypochondriac region. Specifically, surgeons will tell you that it's in the right hypochondriac region. Okay. Now let's zoom in to see the actual appearance of this same gallbladder. This is the gallbladder. This is the liver. So as you can see, the way it is structured, okay, it is under the liver. When something is under something, we call it inferior. Okay. So it is under the liver or the undersurface of the liver. Not that it is attached, it can easily be separated when during surgery. Okay, it has parts just like the stomach, it has the fundus, the body. And what part is this? This is the Hartmann's pouch, the valves of Hister. Okay, so the fundus, this is the dilated portion of the gallbladder. And then the body is the more like the central region. And then there's a neck region here. All these structures, the Hartmann's pouch, the Vaulter's Hester, they belong to the, the neck region. So usually the neck region is the one which is associated with the stones, the gallstones. And again, gallstone is a topic on its own. From the gallbladder, there's a duct. This is called the cystic duct. It it joins together with the hepatic duct, the common hepatic duct. They form a common bile duct. You've seen cystic duct, they join with the common hepatic duct. Anything to do with hepatic means it's coming from the liver. Okay. Like hepatitis. Hepatitis, the inflammation of the liver. Hepatomegaly, it's an enlargement of the liver. So anything to do with hepatitis, it is associated with the liver. So there's this region is called the Carlot's triangle. There are some arteries here passing through this region, and also there is the lymph node. This is very important region for a surgeon, the Carlot's triangle. Okay. So when doing surgery related to the gallbladder, it's important to locate the Carlot's triangle. The cystic duct, let me show you a diagram showing the cystic duct. Since we are discussing the gallbladder here, this is our gallbladder here. This is a cystic duct. It is 3 centimeters long, and the diameter of this duct is 1 to 3 millimeters. And what kind of epithelial cells do you find in the cystic duct? You find what you call the cuboidal epithelium. You remember cuboidal from histology? Okay, there's cuboidal, there's other squamous epithelial cells, columnar cells. So the type in this cystic duct, these are cuboidal epithelial cells. Another feature is that there are prominent mucosal folds within the cystic duct due to the presence of prominent circular muscle fibers underneath. Okay, I think you can see these spiral shaped structures. These are prominent mucosal folds. But here in this other structure, you don't see them. Okay, this is because of the presence of circular muscles. So, what's the importance of these spiral folds? They keep the cystic duct open for drainage of bile. Okay. What about blood supply to the gallbladder? Wow, this is the blood supply. As we see, the color in red is showing the arteries, and the colors in blue, it's showing the veins. Okay, we know this is a cystic duct, we know this is a hepatic duct, we know this is a common hepatic duct. So, which artery supplies the gallbladder? It is the cystic artery. You should be remembering that because there's a cystic duct. So there's a cystic artery that supplies the, the gallbladder. Where is it coming from? When you just follow it, it is coming from the hepatic artery. So a cystic artery is a branch of the right hepatic artery. And it passes behind the common bile duct. Okay? And it branches off, covering the entire surface of the gallbladder. So the cystic arteries, it has been known to be an end artery. Okay, like it doesn't give other branches, arterial branches. No, it's just an end artery. Okay. And then when you look at the veins, there are multiple small veins. You know, veins, they carry deoxygenated blood. After the blood has been supplied to the gallbladder, now there's this deoxygenate. After the blood has been supplied, the nutrients, you know, the gallbladder is made up of cells. So they utilize the nutrients, the oxygen, So there's this deoxygenated blood that is drained into the veins. So there are multiple small veins from the surface of the gallbladder and join the liver surface. Okay. So there's some cystic veins from the neck of the gallbladder draining directly into the portal vein. Okay, and then the portal vein is communicating with the liver. That's why if you noticed, if there's a cancer of the malignancies, let's call them malignancies of the gallbladder, because of this blood communication, it can easily spread to the liver. Okay, so this is the blood supply to the gallbladder. The arteries bringing oxygenated blood and nutrients. It's a cystic artery. After the nutrients has been used up, there's some small veins, and the majority of them drains into the portal vein. Okay, I haven't put anything to do with the nervous system, but it's important to know that the gallbladder, it's under the influence of the vagus nerve, which is cranial nerve number 10. And there is also from your anatomy, you're going to see that it's also under the influence of the celiac plexus. Okay, what about the lymphatics of the gallbladder? If you remember very well, what's the function of the lymphatic system? It drains excess interstitial fluid. We know what interstitial fluid is. It's the fluid which is not in the blood vessels. It's not intravascular. It's not intracellular, but it's just outside these compartments, the interstitial fluid. So it drains excess interstitial fluid. That's a function of the lymphatics. Apart from that, it transports dietary lipids. The other function of the lymphatic system is that it carries out immune responses. So even the lymphatic, when you're describing arterial system, venous system, don't forget to talk about the lymphatics. Okay? Because without the lymphatic system, blood flow it's impossible. Okay? The what we call circulation of blood is very impossible. So we have the cystic node there, the one which is located in the Carlot's triangle. We have other nodes. What are their names? Pericholedochal lymph nodes. Pericholedochal lymph nodes. Okay. Okay. So we have drainages from the right lobe of the liver. Okay, and other lymph system. But I've just given you the general function of the lymphatics. Okay, like drains excess interstitial fluid, transport dietary lipids. As we know, the absorption of lipids usually involves the lymphatic system. Absorption of fat-soluble lipids like vitamin A, D, E, K. It involves the lymphatic system. It carries immune response from immunology. You remember that the lymphatic tissue initiates highly specific responses directed against particular microbes or abnormal cells with the assistance of what we call the macrophages, the T and B cells, okay, which recognize these foreign cells. Okay, that's another topic on its own. Now, physiology of the gallbladder, like what is the function? What does it do? Why is it there? Okay, very straightforward. It's a globular structure, I mentioned. So, one, it stores bile. Bile. It stores bile. Bile, very important. It has bile salts, it has bile pigments, it has cholesterol, and many other. Very important in the digestion of what? Fats. So bile storage, that's the importance of the gallbladder. So look at this quantity. It stores about 500 to 100 mils per day. Very important parameter. The other